Welcome, everyone. I see that little by little we are getting everyone to join this event taking place today on International Childhood Cancer Day. This is to mark this special occasion in our February's and annual calendar. And I mentioned February because February is a month that also sees the marking of World Cancer Day, which is also a day to raise awareness about cancer. And 2 weeks later or 10 days later is International Childhood Cancer Day. So it's really a month of awareness in such an important cause, which is to provide access to treatment and to children with cancer all over the world. Today we are here to talk about childhood cancer in the region. I don't know if I should maybe wait a little bit more to get more people joining. But I think we are a critical mass already. So I will start by introducing myself. I am Laura Fernandez Diaz. I work in the Union for International Cancer Control based in Geneva. And it is my honor to be here today moderating this event, which is childhood cancer in the region, where we are at and what are the plans for 2023. This is what we will be discussing today. And for that, we have a panel of experts in the area. And just before that, I'm going to go over a couple of housekeeping rules. First of all, please keep yourself muted unless you are talking. And for that, I will give you the word when it's appropriate. Cameras on. It's always nice to see the audience and who we are talking to. So please let your camera on if that is possible. And use the chat box for introducing yourself, to let everyone know who you are, from where do you work, or what's your area of work, and to let us know if you have any questions at any point. I'm going to go ahead and introduce our panelists. So we have Mrs. Hannah Charchuaib. She is the CCCL's General Manager, and she's also on the board of the Union for International Cancer Control, as well as CCCL UK. She was awarded actually UICC's Best CEO of the Year at the World Cancer Congress in Geneva in 2022. She's a passionate leader and advocate in childhood cancer. She has led CCCL for over 19 years, transforming it into the region's center of reference that has pioneered the treatment of children with cancer without discrimination and without parents incurring any cost. Mrs. Nisreen Hatamish, she's joining us from the King Hussein Cancer Foundation from Jordan. She's a visionary social development and health policy leader in the MENA region. She leads with impact through developing novel strategies, and currently she serves as the CEO, CEO of the King Hussein Cancer Foundation, which is Jordan's largest healthcare NGO. She is a tireless advocate for cancer patients' rights and for their needs to be a top priority of policymakers. In her capacity as CEO, Mrs. Hatamish actively champions equal access to comprehensive cancer care for all people in Jordan and in the region, with a specific focus on refugees and other vulnerable groups. She will be followed by Dr. Andre Ilbawi, who is joining us from the World Health Organization. He's a technical officer in the Cancer Control Department of Non-Communicable Diseases Division of Universal Health Coverage. Dr. Ilbawi is a medical doctor and joined the WHO in 2015. And now serves as the focal point for the cancer program at WHO. Amongst other initiatives, of course, Dr. Ilbawi led the launch of the WHO Global Initiative for Childhood Cancer in 2018, now being implemented in more than 30 countries. Dr. Hassan Bibi is the Director of External Affairs and Levant MSD Levna. Hassan has many years of experience in international pharmaceutical companies, and his expertise enabled him to be an active member of the pharmaceutical corporate world. His experience in different functions with regional responsibilities played a major role in helping him to establish and lead multiple local pharmaceutical working groups. He was also part of many global health initiative campaign movements sponsored by top performance and inspiring leaders such as the former president of Lebanon, Michel Suleiman, US President Bill Clinton, and Queen Rania of Jordan, to name a few. His extensive career has seen many more milestones and achievements that I'm afraid we won't have time today to go over all of them. Finally, Katarina Gralen, she works as a health economist at the Swedish Institute for Health Economics, the IHE. She works with policy studies in the healthcare area, both in oncology and other disease areas. She has experience from both literature reviews, interviews, and questionnaire studies. Katarina previously worked over 10 years in the government offices in Sweden. So first of all, thank the panel for joining us today. As you can see, these are all our panelists that will be talking with us. I'm going to stop sharing because I will give the word straight away without further ado to Mrs. Nisreen Khatami. She's going to talk to us now, and Nisreen, the floor is yours.
Thank you, Laura. Thank you, everyone, for attending and for being with us today. It's a very important day, and it's a very important month. We are celebrating our efforts collectively at the global level and at the regional level to fight cancer, and more specifically, spreading awareness about the importance of adopting a healthy lifestyle, and at the same time, ensuring equal access for everyone to the same quality of care across the globe. So thank you, everyone, for your commitment for this cause. And we are here today in specific also to celebrate the International Pediatrics Cancer Day. We are all committed to make sure that our pediatric patients also have equal access to the same quality of care, regardless of their socioeconomic background and the living conditions at different levels. So to do so at the King Hussein Cancer Center and Foundation, first of all, I would like to give you a quick brief about our work. We are a comprehensive standalone cancer center that treats adults and pediatrics. Currently, we are treating 27,000 active patients. We receive 7,000 new cases annually, among which we have 500 pediatric cases. So although the pediatric cases are around 10% of our total new cases annually, however, we have specific programs and patient's journey for pediatrics, which is really different and it's comparable to the international standards. And to do so, we have different partnerships with medical partners in addition to the different partners in different areas. But in partnerships, medical partnerships, we are partners with St. Jude. So we follow their guidelines and their treatment protocols in the US for pediatrics in cases in specific. And we also have a strong sisterhood partnership with MD Anderson and in the US, again, in addition to other partnerships in Europe and in the region, in order not to reinvent the wheel and really learn from others to make sure that we are providing our patients who are coming to our center, not only the Jordanians, but also the underprivileged patients and vulnerable populations from the refugees who are living in Jordan, the same quality of care received in the best centers at the international level. In addition, we invest a lot in our quality control measures. So we have, and we are working on daily basis on integrating quality management as a culture among all the functions at the center and the foundation. So we work on accreditation, certification, capacity building programs for our doctors, our nurses, the support team, and even the administrative team to make sure that we are working all together in harmony on one culture. The main value and the main theme of our culture is caring. So we are adopting a caring culture. We are taking care of the patients and their families and their support family members to make sure that the patients are going into this journey with full support, not only within our premises, but also a support from the community. And to do so, we also work with the community with different interventions at the community level to make sure that everyone is there to support the patients and their families during this journey, as I mentioned, but not only to support the patients, but also to work on adopting healthy lifestyle to prevent cancer and promote early detection of cancer as well. So this is how the foundation is working, and to do so, we do different public awareness campaign, adopting the social behavior change communication concepts, and the advocacy at the policy level concepts as well, in order to create an enabling environment for our work to be done in a perfect way. I know that I will dig deep more into the services that we are providing to pediatric patients in specific, but I will leave the floor for my colleagues also to share their experiences, and then I will share more. Thank you, Laura.
Thank you so much, Nisreen. We will hear now from Hannah Chartuave. Please, Hannah, the floor is yours.
Good afternoon, everyone. So it's always a pleasure to be with you among this distinguished audience, and I'm very confident that it will be a beneficial panel. I thank the organizer at both institutions, the Children's Cancer Center of Lebanon as well as King Hussein Cancer Foundation, for their initiative to keep the momentum, especially on this day, the International Childhood Cancer Day, and to commemorate it as well. As we are marking this day, we are here to discuss a series of issues facing Lebanon and the region, which are creating major gaps in essential care, where we do have low resources dedicated to cancer. We all know that in Lebanon since 2019, the country has been threatened by a financial, economic, and political crisis, which was only intensified with the spread of COVID-19 and the Beirut blast, and lastly followed by the drastic devaluation of the Lebanese currency. All these circumstances has put the Lebanese healthcare and other services such as transportation, food security, infrastructure, and the basic needs all at a very high risk. Cancer care providers and organizations have been facing dreadful shortage of qualified staff as people and qualified medical representatives fled from Lebanon in search of better and more secure life abroad. Nevertheless, we at the Children's Cancer Center of Lebanon, our main objective remains to ensure that every child with cancer in Lebanon and the region has access to adequate treatment. And which also applies to thousands of refugees. And the program that we had created since the Syrian crisis in 2011, with the support of Al-Zaq St. Jude, our partners, and in the country, it all has accommodated in the recent years from other conflict zones such as Syria, Iraq, and Palestine. Here, I must highlight on the work at the Children's Cancer Center and the medical team's efforts throughout the past 21 years of its operation. I'm glad that we have today with us Dr. Samar Muakkad, who she is a professor of pediatric hematology oncology at the clinic. And I would like, if you don't mind, that Dr. Samar share with us some statistics about the accomplishments of the center during the past years. Dr. Samar.
Hello, good morning. Hope you are hearing me well, and thank you for giving me the chance to speak during this prestigious meeting, which I think is very important. It's very important for us in the region to keep together to speak about our issues. So up till now, the center has supported the treatment of around 5,000 children with cancer. It covers the full costs of treatment and surgeries, in addition to medical consultations and medications offered to children from all over Lebanon and the region without any kind of discrimination. So we work on first come, first treated basis. On a yearly basis, the center covers around 8,000 hospital admissions and more than 15,500 outpatient visits per year, including an average of 2,850 chemotherapy sessions and more than 1,500 radiation therapy sessions. Since 2012, the Children Cancer of Lebanon Center of Lebanon has covered more than 113 bone marrow transplants, 15 limb salvage surgeries, 4,000 lumbar punctures, 2,300 bone marrow aspirates, and 922 examinations, eye examinations under anesthesia. Finally, since all these challenges not only affect the patients and their parents physically, but also morally and psychologically, 450 psychological sessions were provided and are still provided yearly to our patients and their parents. Now, on top of all this and the economic crisis, we had a very big problem in Lebanon, which is the suspension of subsidizing the government of medications, which usually used to take a big burden out of our shoulders. Now, many of the medications are out of stock, especially the ones related to cancer, especially the very expensive ones. And this forced cancer patients and organizations to purchase the needed medications from abroad at a very, very high cost. Third-party coverages have been reviewed and suspended in many hospitals, and as of yesterday in all hospitals, and patients are increasingly burdened with out-of-pocket payments. Of course, this does not happen at the Children Cancer Center of Lebanon, but all over Lebanon, people going into hospitals are paying out of pocket. So this is all on the this is all extra burden on the shoulders of the Children Cancer Center of Lebanon. We are noticing more and more that cancer patients are turning to civil society organizations and NGOs for support in covering not only treatment costs and medications, but also the basic needs such as food. And I would like to mention that organizations in cancer care and other similar organizations are facing a real issue. If the whole country is facing a real issue, what about a cancer organization that treats free of charge? So we have all over the country a problem of survival. However, at the CCCL, despite the enormous challenges, CCCL continues to engage in proactive work, investing a lot of effort in contingency planning, but even this has become difficult. In the absence of almost all governmental interventions, policies making, and law changing, and the implementation of any existing help, CCCL was driven to follow a national cancer plan and embark on new innovative solutions, such as giving vaccines, the HPV vaccine and the COVID vaccine to prevent disease, and to safeguard patients' survivals, parents, and employees. So hopefully I gave you an idea of how difficult it is to survive and to be responsible for a Children Cancer Center funding in Lebanon. I thank you, and I will leave it to Hannah to elaborate on the whole issue. Hannah?
Thank you, Dr. Samar. Sorry, I couldn't see Dr. Samar joining us before and without asking her just to give a quick intervention. So as such, we can realize how much providing cancer care is becoming very difficult these days in Lebanon and the region. And also, I cannot but also mention that the most recent devastating natural disaster that happened in our neighboring countries, Syria and Turkey, that left us really stunned with limited resources. And although we tried to see how to help and how to start the conversation, but unfortunately, even contacting these institutions and associations in these countries is becoming very difficult. This is also to highlight on the needs of the financial planning and how it's important to have financial planning and stability to overcome these challenges, where I know that one of our notable panelists, Mrs. Graylan, will inform us about it in a bit. On an end note, and despite all challenges faced, a glimpse of hope comes from the WHO, where they informed us during our encounter at the World Cancer Congress in Geneva that shift of priorities are seeing the light, and childhood cancer is one of the 3 shifts for the EMRO region. I leave the floor to one of our distinguished panel, Dr. André Elbaoui, to inform us and give us more hope about this matter. Thank you.
Thank you so much, Hannah. Thank you, both Hannah and Dr. I'm sorry, Samia. I forgot the name.
Dr. Samar Moat.
Thank you so much for this account of the challenging situation in your country, and it really is a day to raise awareness on these difficulties. Same for Nisrin Khatamish and her accounts on the work in Lebanon as well. So we will go ahead with the panelists. We will take questions at the end and continue the discussion. So Dr. André Elbaoui, the floor is yours.
Thank you. A very warm greeting to each of you on this important occasion of International Childhood Cancer Day. Just looking through the list of participants, it's been such a pleasure to have come to know you over these years. I see many friends and colleagues, many people from whom we took the inspiration of the Global Initiative for Childhood Cancer. And as we just heard from Mrs. Hannah, what we hear is this ground swelling that childhood cancer has been neglected for too long. So our dear colleagues from CCCL, from King Hussein Cancer Foundation asked us to speak, how is the initiative coming along? We all know the justification. In 2018, we sat together with the recognition that childhood cancer is perhaps one of the most profound inequities in global health. A child who lives in a high-income country can survive 80 or 90% of the time compared to a similar child in a low or middle-income country where survival is 30% or less. We know that fundamentally, this gap, this divide, is simply because services aren't available. There are other factors on treatment quality, but this is not about the latest therapy. This is about human rights. This is about basic cancer care not being available in most low and middle income countries simply because it has been ignored, neglected, and underfunded. This is the foundation for what all of you have come to know as the Global Initiative for Childhood Cancer using the Cure-All approach. We're almost 5 years in, so it's time to have a very frank assessment of how are we doing in line of the goal that we set as a community, and how have we achieved the objectives that have been agreed upon. It's difficult to say the progress in survival, and I'll raise that later, but we do know we are making progress in improving the number of children by country who are able to access and complete their therapies. But when we look at these objectives, let's break them down. Are we now seeing more countries take on childhood cancer as a priority? Are we seeing more activities and capacity building exercises? As we can see from the slide here, we've been measuring this. We have 10 types of activities that we've been tracking in the past 5 years to see how governments are able to deliver on it. And this is a point of encouragement. We all know the pandemic has really threatened health systems, has threatened economies, has threatened our programs in childhood cancer. In spite of that, if we look between 2019 and 2023, in 2019, there were less than 20 countries participating in the Global Initiative. Now we're over 65. 65 governments that have come forward and said, we want to be part of this initiative. We feel the community activation. We understand why childhood cancer is a priority. We are going to take action on these specific areas that you within the initiative have delineated and which you as the community have said as the important actions. 65 and growing. That is a major, major achievement, and it was done because of each of you. It was done because you believe and you've been advocating for childhood cancer to be a priority for decades. Now we see governments taking action. But has this translated, as we heard so well from our first 2 esteemed speakers, into resources? So if we look fundamentally now at the resource allocation to childhood cancer care, excuse me for the slides, we can see that childhood cancer, while it's emerging as a political priority, is not being matched in resources. As a recent example, we analyzed every country's benefit package. That is, what are governments paying for? Are they paying for TB, for child health, for cancer, for childhood cancer? You can see here, still less than half of governments pay for essential or even core childhood cancer services. You've heard so well already the consequence, financial hardship. These are families that are selling assets simply to access cancer care. That's not acceptable. Why do we see this as a problem? Because again, there's a disconnect between developing plans, developing priorities, and putting money in there. We've seen, for example, some countries like in the Philippines or in Peru introduce new legislation that childhood cancer should be part of universal health coverage. But if we track the results chain, if we look downstream and say, are in fact governments putting money behind this new legislation, or are systems being developed to ensure medicines are reliably available? Unfortunately, we see that quickly there's a drop-off between intent and outcome. This is now the second phase for the initiative. How do we take all those inputs, all those activities that we've been seeing grow, and translate them into improved survival? There are a few guiding principles to highlight. First and foremost, we do need those comprehensive strategies with a value framework and strong governance. Who's going to own it? Who's going to be accountable? And also who's going to put the resources to make sure that it's implemented effectively? I just want to again share with you words of encouragement here. We're increasingly working with governments to cost out their cancer plans, to say, look, if you want to invest in childhood cancer, we're talking about 10 cents per capita. That is not a big ask. We're talking about hundreds, thousands of lives that you can save. And we present it in language that it resonates with ministries of finance, that resonates with other financial sectors, so that they can see that an investment in childhood cancer is a justifiable and necessary investment that's feasible and offers that value for money. In addition to that, we're also bringing more attention to the narrative of how do we resonate these ideas of value for money within the communities. Because if you ask a parent, what is the value of having childhood cancer treatment available? It's not just about the best therapy. It's about the broader system. Is it available?
Thank you.
We know as an example that when someone is diagnosed with cancer, the child, their parents suffer immediate trauma and profound trauma, anxiety, depression. And this translates into further downstream problems for that community, for that family, and for that economy. We see, again, over 60 or 70% of families thrown into financial hardship. We see increased divorce rates. We see loss of employment. We see generational poverty simply because of a cancer diagnosis. So in our work in the initiative, we're reframing childhood cancer not only as can we get the medicine and the care to the child who needs it, but can we create an ecosystem that supports a family in this most difficult journey that so many families have to endure. In order to accelerate that work, I won't spend too much time on this, but we launched a lived experience campaign. This is a community-led campaign to better understand what are those priorities. Activities like paid family leave, to financial protection, transportation, and indirect cost coverage. We want to hear from the community, what are your priorities? So we can take that to a political and policy level. Because yes, treatment is important, but we have to make sure the broader system is there to support people diagnosed with cancer. And as many of you know, one of our key strategic partners, and it's so nice to hear them acknowledged here, St. Jude Children's Research Hospital. With St. Jude, in addition to the initiative, we now have launched a commitment to ensure that every child who has cancer can have access to quality assured, sufficient number, and affordable cancer medicines through what is known as the Global Platform for Access to Childhood Cancer Medicines. Friends, colleagues, we are opening a new generation. It is so encouraging to know that we are able to achieve this and we're able to deliver improved care for our children, for our communities and beyond. You can see what we've been doing together. But before closing, I just again want to say thank you. Thank you because you are the grassroots that have driven this change. You are the grassroots that we look to better understand whether what we're doing is impactful or meaningful. You are the ones that ultimately are improving the lives of children and their family. Thank you again to CCCL. Thank you again to King Hussein. And we look forward to continuing this discussion and advancing healthcare for all so every child with cancer can live a full and abundant life. Please, back to you.
Thank you. Thank you so much, Dr. Andre. Very interesting and powerful presentation. We will continue, as I said, with all the panelists, and there will be an opportunity for questions at the end. So I'm giving the floor to Hassan Bibi, representing the private sector, pharma, MSD. So Hassan, the floor is yours. Not sure if we can't go straight to Hassan. Maybe Katarina, if you are ready with your presentation, maybe we can continue with you. Thank you.
Okay, so you want me to start and we do Hassan afterwards?
Exactly.
Okay.
Thank you.
Then I will share my screen, just one moment. And I hope you can see it now. Great, thank you. And thank you so much for this kind invitation. And it's my great honor to be here today and participating in this panel with all these honorable people. And I also want to thank both foundations for arranging this panel. So I will present the IHU report, Cancer Care in the Middle East and Africa. It covers both the disease burden of cancer and the economic burden, and also includes some policy recommendations. Covering 9 countries in the Middle East and Africa. It's South Africa, Morocco, Algeria, Egypt, Lebanon, Jordan, Kuwait, Saudi Arabia, and the United Arab Emirates. So why is the fight against cancer so important? Well, we do have the disease burden. We all know that historically the number of patients has increased. And from this figure, we also have the data from the Global Cancer Observatory, WHO, that the estimates for the future is that the number of new cases will increase from 410,000 in 2020 to 720,000 people in 2040. And the same goes for mortality, it will almost double. So we really want to do something to avoid this and work together. So the increase will also increase the population will age, and also we have the increased risk of smoking and obesity. And it's also one of the leading causes. It's the second in these countries after cardiovascular disease. So it's a big burden on society. So in addition to the disease burden that we just saw, we also have the economic burden, and it was mentioned by previous speakers. If we use a societal perspective, which is a bit broader, we include 3 types of costs. And it's the direct costs and indirect costs and informal care costs. And the first cost is the one we normally think of, the healthcare resources such as personnel, the cost of drugs, equipment, measures, etc. That could be either publicly paid by tax or insurance, or it could be privately paid. But it is also very important to add the other 2 costs, the indirect cost, and that is the cost for lost productivity, because when a patient is sick from cancer or other diseases, they can't work. And also the patient pass away prematurely. We lose that addition to productivity in society. And the third one, the informal care cost, is the value of all the time spent by the informal caregivers that support the cancer patients, such as family and friends. And especially the latter 2 costs that are extremely heavy when it comes to children, as if a child passes away prematurely, we will lose that potential future addition to society. So those parts are very important. And also this societal view, including all the 3 costs, is very important, as it helps understand that the public spending on cancer care, that is the direct cost, it's actually not a cost. It could be seen and should be seen as an investment because it improves health, and thus it can reduce the indirect cost and informal care costs in the future. So this is a strong argument for public spending and the investment for healthcare, because it will save money for society as a whole in the end. And I think it's also a very strong argument for public spending, and that it could be used in dialogue with stakeholders and policymakers. So how should we go ahead to achieve this? We need to tackle it in a comprehensive way, and we have 4 key areas of cancer control: the prevention, early detection, diagnosis, treatment, and survivorships. And the first 2, they reduce the cancer risk from the beginning, while the early detection, diagnosis, survivorships, they improve the cancer care, survival, and the quality of life. But in addition to these 4 main key areas, we also have governance, because we need someone to take like a coordinated role so that it holds together and move in the same direction to reach the same goals. So that also includes supporting research and innovation and inequalities to care. So on the positive side, we have, in terms of finding money for these to invest in cancer care, for the region, the Middle East and Africa, it's in a very favorable position in these coming years, for the next 20 years, as you can see from this figure, because in this region of the 9 countries, the share of the population of working age is stable over time and actually a bit increasing, the orange block in this figure. So that means that it generates, it's with the working big share on working population, it builds a strong economic situation to generate taxes, and these taxes can then be used to invest in cancer care and health care, and also implementing the preventive measures now when the population is young. Then you will benefit that in the future when people are old and are more prone to getting cancer. So how do we go along to do this? The general steps to improve cancer care could be to measure and understand the disease and economic burden of cancer that we just looked at, and the IHE report that is, I will share the link with you in the chat afterwards. They report and present this evidence on a country basis so that it can be used in the discussions with policymakers, because then you can size up how big the burden is. It's also important, as was mentioned by previous speakers, to plan, coordinate, and implement, and also to have a national cancer control plan, including finance plans that I think Mrs. Hanna mentioned. And this is also recommended by WHO as a strong way to go forward. And in this report, the IHE report, we also provide 20 to 30 recommendations per country on how to strengthen the cancer care situation. And also, finally, it's very important to monitor and evaluate actions on cancer control, because if you just have a plan and a document, but you don't follow it up, it could be more visual situation. You need to ensure that the work benefits the patients. And for that, it's very important to have cancer registries that are updated and established for these purposes. And again, what are the other recommendations related to these 4 key areas that we saw? For prevention, we could work with fighting obesity, unhealthy lifestyles, also including vaccination programs for HPV. And this is especially important when we have a young generation, because that will benefit society in the end. Regarding early detection, improving health literacy, so that the population and the people know what to look for and what to be aware of. Also, breast cancer screening and other screening programs are very beneficial. ensure good cancer care and access for all residents, also in less populated areas, and regarding survivorship, to increase access to psycho-oncology and also support the informal caregivers. When it comes to governance, we can aim to reach for the WHO spending target on 5% of GDP, and also, as mentioned before, strengthen cancer registration so that you can follow up on all the policies and see that does this really benefit the patients and do we see an improvement. And final, we want to stress that cooperation is vital. And this is today's meeting and the panel is a great example of that. To sit down together, bring back everyone to the table, the different stakeholders, talk and discuss on the best ways forward. So, and as I mentioned, the full report from IHE is able to download for free, and I can share the link for the ones who are interested. So thank you very much for this opportunity to share the results. Thank you.
Thank you so much, Katarina. And I really like ending in that note of promoting collaboration and cooperation, which is really what this forum is about, this meeting today and many others. I don't know if
yes,
Hassan,
hi.
maybe. Oh, wonderful, yes. Wonderful.
Yes, I'm really sorry for the technicalities. No, we always face some surprises, but it's good that Katarina did the presentation before me because I want to build on the cooperation as well. And this is why I'm representing now the industry to really show how much we can do together as a public-private partnership. So we as MSD, definitely leading pharmaceutical companies are unified around, and our purpose is of leading edge science to save and improve lives around the world. So I will try to share my presentation. Can you give me, can I share?
I think so.
Okay. So just somebody tell me if you see my screen.
Not yet.
Not yet. Okay. So what about now?
Oh, it's starting to be there. That's it. It's all good. Go ahead.
Okay, great. So as I said, I would like to begin with MSD purpose. So definitely we are, as MSD, driven by our purpose to use the power of leading edge science to save and improve lives around the world. As you can see, our legacy began more than a century ago and continues till today. From 1891 till 2019, you can see how much we really leading science towards a better future and better public health care future, where we started with the first diphtheria antitoxin introduced to 1936 with the chemists from MSD and Bell Labs synthesized to 1940 establishment of animal health, and then MSD begins to until we reach definitely 2011 from an MSD for Mother established to reduce maternal death, a worldwide introduction and initiative, then to 2019, where along international agencies and governments, we help respond to Ebola, to a outbreak. In the oncology side, we work to invent world-class cancer isn't just as treated, but cured. So our goal is to translate breakthrough science into innovative oncology medicine to help people with cancer. More than 100 million patients who have been treated with the commercially available Merck, also oncology medicine. We also, is also to deliver healthcare of tomorrow, okay? So, excuse my, I'm not really accessing my, so our responsibility is really to deliver healthier tomorrows through our medication and vaccine that can help patients and communities around the world, and definitely in our region within Levant and Levna. We work for the future where cancer isn't just treated but cured. We are proud to deliver breakthrough innovations in oncology to help extend lives, and patients. We believe we have an important role and responsibility. And this is admire the cooperation between different stakeholders. It's not about only the healthcare system. It's not about only the government. It's not about only the healthcare, let's say, companies. It's not about only science. It's about NGOs. It's about the patient's voice. It's about every stakeholder that can really help and bring innovation and bring support to our patients in need. So the legacy of MSD is really big. So as you can see, we also focusing on making certain disease a thing in the past. And this is why we are today and happy to contribute in this panel. And sorry, I didn't start with thank you, a big thank you to CCCL, to all of you to really bring MSD in the panel to share our purpose, to share our goals, and to share our ultimate objectives toward our patients. We are also definitely innovating in patients in the hospital of creating a better world, where hospitals and care is one of the current key growth pillars as well, to reduce the symptoms and to support patients in need. Again, sorry. So last but not least, we are committed to patients. That's why we pursue the best science in our inventions and everything we do. I will stop here to jump to what we really did in the region so far. So you can all be proud of what MSD is bringing to the table, what we are doing to establish a kind of a cooperation and a kind of a coalition between the industry, the NGO, the healthcare professionals, the pharmacists, the patient, the government, the parliamentarian health policy makers. So let me jump to the other slide deck, if you allow me. I hope it works. I will stop share. I will open it. Okay, so, all right. All right. Do you see the slides?
No, we see your very busy desktop, Hassan.
Yeah. Now?
Now we see the desktop, yeah.
Okay, great, great. MSD is really proud. We are all proud. I'm really happy to let you know that within the last 2 years, we initiated and we executed a kind of a great cooperation with our KHCC, KHCF about MSD for Mothers. MSD for Mother is MSD initiative, help create a world where no woman has to die while giving life. This initiative supports the corporate grant program, which enables MSD offices around the world to aid and to improve non-governmental organizations that are improving maternal health. And this was with the first and one of a kind that is established in our region, and fund KHCF in Jordan within their breast cancer program as an activity, including promoting early detection and outreach campaigns. The second that I'm proud to, and these are really the elite activities and initiatives that were done to here we are proud that 2 Health Equity Catalyst Fund were also is also a global initiative, but also implemented in our region a couple of months ago. It's having 2 grants to improve equitable health outcomes to the communities where we serve, aligned with regional strategic priorities. The Healthcare Equity Catalyst Fund supported 2 initiatives, one in Lebanon and one in Jordan out of 13 countries. And we're so happy that we have this grant, which is around 150K established and being initiated to really serve the high unmet need around cervical cancer prevention and have a high significant population health impact. So last but also not least, and this is only an example, during this year World Cancer Day, we really recognize that the World Cancer Day theme close the care gap, we renew our commitment as a leader and as MSD, which is which is the #1 trusted company serving patients, helping patients to improve their lives, especially in the oncology, to reduce disparities in cancer outcomes through our efforts in cancer by screening, prevention, and treatment. So we challenge ourselves today and every day to innovate and form a unique collaboration and partnership by working with HCPs, patients, advocacy group, policymaker, as I mentioned. And here you can see some picture where with the initiative that and we as MSD very happy to be really recognized to be also engaged in such activity. Last but not least, work to patient organization include and is not limited to empower patient organization to keep raising awareness on common cancers, connect patient with international ones, and to learn and exchange best practices and create platforms to become really the support player and support and advocacy efforts. Increase patient organization healthcare literacy on cancer and other diseases and potentially long-term disease burden associated with healthcare risk and prevention solution. Last but not least, to build powerful partnership and establish strategic alliances by supporting coalition formation. So this is the purpose also of MSD, which is #1 priority, really to engage with everyone, to accelerate support, to really bring network together, to form coalition, and so all speak the same language. I will end up again with this slides. Patients are our purpose. That's why we pursue the best science in our invention and everything we do. Every breakthrough we create has the potential to build a healthier, right? More hopeful future for people everywhere. Thank you so much for giving us this opportunity.
Thank you, Hassan, for your presentation and showing this passion about what you do. Is very clear why you do it, and it really again, talking about passion, every speaker and every panelist has give us a excellent address of the situation in the region, as and specifically in Jordan and Lebanon. Unfortunately, this passion means that we are taking a little bit of extra time of what was planned, but I think it's always good to hear all the panelists and all the food for thought that is being shared. So I'm gonna ask quickly the audience if there is any burning questions for our panelists before continuing. Otherwise, I think because of timekeeping issues, we will probably continue with the program. So I see if anyone quickly wants to, let's see. I'm checking. I think there was a question. Let's see. Sure. I can see any questions. Okay. I think there was a question raised earlier on around the workforce, but I think maybe given the next part of the discussion, we'll go back to Nisreen and Hannah. Maybe you can take that forward in your address. So perhaps I'm going to give the word to Nisreen again. And,
thank you, Laura. Thank you for the inputs from my colleagues. Actually, it's really inspiring to me to know that all these efforts are being made by the private sector, the non-governmental organizations, the international organizations, for one purpose, which is really to ensure equal access for all patients in the region and at the global level, and to make sure that equity and equality in cancer care is guaranteed through our efforts. So yes, the patients are our purpose, all of us, the patients and their rights and their well-being and their mental health is also a priority for all of us. And that's why we are today here. From here, I want to continue about the efforts that we at the foundation and the center are doing with regards. I mentioned a lot about the quality of care that we are providing. But I want to zoom in the part of the mental health and the psychosocial support that we are providing for the pediatric patients in specific. So psychosocial support is a main element and the primary element of our interventions with the patients and their families. So for the pediatric cases in specific, one of the major things that we were thinking a lot of is the continuity of education while getting treatment for the kids. So that's why we introduced a back-to-school program, which has been implemented in collaboration with the Ministry of Education in Jordan and the different parties to make sure that the patients are able to continue their education within the premises of the hospital while they are receiving their treatment, being inpatients or outpatients. And this guaranteed the continuity of education, guaranteed the change in the perceptions of the community about cancer being, a sentence of death and end of life, and change the perception toward more hope, and people can continue their life after cancer normally without having their education compromised, nor their social life, nor or any other element of their life. And the program is a very successful program. It's now 10 years old program. Thousands of patients benefited from the program. They not only continued their education while they are getting the treatment, but also actually their scores. We are hearing a lot of success stories that the scores and grades of the kids who are receiving the support from our volunteers and our teachers at the center are improving when they go back to their normal schools and normal life. This is on one front, and the other front, and building on the success of this program, we also created a special support program for the secondary school students in specific at the age of 18. So we help them to navigate the process of, the high school years, which is not easy for anybody who are not facing the challenge of cancer. What about a kid who is facing the truth of cancer and the process of treatment of cancer? So we are providing a sort of psychosocial support, mental health, stress management, anger management, anxiety management, and so on. And we are helping them to navigate the future while they are also facing the challenge of cancer in their life. And after that, we also introduced the universities program, where we are providing the scholarships for those who pass the secondary school exam and want to go to the university. For the underprivileged patients in specific, and more specifically the refugees, we introduced this program to ensure continuity of education after cancer. This also touched on the point of productivity and the ability to go back to the community with full productivity, full engagement, and full ability to be a productive and successful citizen in the country. On the other front, also through our mental health program, we created different programs and different interventions, being the creativity program or creativity therapy program, Dreams Come True, music therapy, and other kind of programs and interventions through which we are fulfilling wishes for more than 3,000 patients so far, providing different kind of supports for and activities and engagement with the communities in different ways and different forms. The most important thing about all these programs is really the collaboration between the community, the private sector again, and other governmental and non-governmental organizations. All of us are working with one goal, which is really giving the most that we can do for the patients and their families.
Thank you so much, Nisreen. Hannah, perhaps you want to add a little bit about continue the discussion.
Exactly. I'm very, very glad that we have joined all together and organized this panel, because you see that the importance of such days where we can all gather together to put emphasis on these collaborations, and as well to see how we can commemorate and highlight on the importance of these days, and to highlight also the importance of these activities and collaboration. So thank you, King Hussein Cancer Foundation, for taking the time and organizing this along with our Children Cancer Center of Lebanon team. And in this day, I will add up to what Nisreen just mentioned. Honestly, the panel was like so rich in content, and it put the emphasis on these collaborations. And I want to thank the MSD for sponsoring the event of lighting the monuments with the Children Cancer Center on the World Cancer Day. And today we will be lighting also the Rawshi Rock, but with the gold color, and also with the support of MSD. So the activities that Nisreen mentioned also are very important. And this is a program where we at the Children Cancer Center of Lebanon have it long time ago. And our patients were this week creating the letters of the ICCD in an artistic way, like I don't know if you're seeing the photos of these activities, as well as the expressive activities that are being performed at 5 partner hospitals. And here it's important to highlight on these collaborations, because these programs were established in partnership with some governmental institutions, some ministries, and some international organizations. So we have these programs funded from these organizations. Such days are important because this is the beautiful work of the children that they have done in the past week, and we also email our supporters on these occasions to highlight their importance, and we continue with our prevention approach by raising about childhood cancer and the HPV throughout the month. We also encourage supporters to participate for the rest of the month in the CCI hashtag through their hands, the Tree of Life. So as ways out of the situation, I'd like to mention some points that are really interdependent and need to be worked on all together, because we have to encourage the private sector and the philanthropists to include funds as part of their CSR programs and commitments. So this will help the NGOs in a very beautiful way how things can be done, and to increase and emphasize on the role the global stakeholders such as the WHO and the United Nations, where they can enforce recommendations and strategies. And this, if we also relax the need to relax the bureaucracy of regulatory institutions such as the FDA and CDC, similar to what had been done during the COVID pandemic, because when everybody acted together and acted quickly, we saw like the vaccine matured in quite no time. So this is also how we must convince governments that putting money in the health system will yield good return on economy, on the budget, on the health system in general, and also to encourage all the civil societies and the patients active group, who are the most important ones, because they are the implementing arm of these policies for the governance, for prevention, diagnosis, awareness, and all the cancer spectrum. As well as patients and their families have to be included into any of the discussions that are being done with the international institutions such as WHO or the UN health strategies. I think these 5 ways are very interrelated, and whenever you have funds, it will be very useful but these funds are not enough if you don't have like a foundation to embrace this cause, and then embracing this cause will not be like beneficial if you don't involve other stakeholders. And this is why you see it in order for them to issue recommendations and to implement roadmaps. And no roadmap can be implemented without this coordination of everyone all together. So we see that this these are all interdependent, and you see the importance of these collaborations. And our panel today is a clear example of these collaborations, to the beautiful work that these collaborations can lead to. And I guess this is all. If anyone would like to have any other questions, it's fine.
Thank you so much, Hannah. And yes, exactly. I couldn't agree more. This panel today is an expression of pure collaboration, incorporating all the stakeholders in the sector, which is so important to achieve the objectives that are, at the end of the day, the heart of what we do, which is cancer patients and access to treatment, and closing the care gap in cancer, and achieving, that all children have access to treatment, because we know that figure that Dr. Ilbawi was sharing earlier on inequity in childhood cancer is just impossible to accept. So I think this is really why we are here. And thank you again to our hosts, both CCCL and King Hussein Cancer Foundation and Cancer Center. Is really, you are signature centers in your countries, and really an example of leadership in the MENA region. So I can only say, I think, speaking on behalf of everyone here, thank you for that. I don't know if amongst Katarina, Hassan, and Andre, you have any final remarks. I think your presentations were very comprehensive, and I'm sure that you said everything you were intended. But of course, the floor is yours if you want.
From my side, Laura, as you said, our slides were really very comprehensive, and it all show that together as one team, together as with having one spirit, we can do a lot for our patients. So I just hope and encourage that we really need to stay together, connected together, for the best for our patients. We can do a lot. And as Hannah mentioned, the early we can maybe screen any disease, the less budget, let's say, at the government. So it's all a win-win at all level. The patient win for his health, the government from a budget, the NGO, more support. I mean, we can do a lot. So thank you so much again for the opportunity for CCCL, KHCC, KHCF, and looking forward to continue our partnership together. Thank you.
Thank you, Hassan. I don't know if Andre, Katarina, if you want to have to say a final word. We have a survivor from childhood cancer today as well amongst us that will share some words. But before I introduce her, that is joining us right now, I just wanted to quickly wrap up the panel. So, Dr. Andre, I see your mic is off, so please go ahead.
Thanks, Laura. No, I just again want to appreciate the importance of this. Many of you we know are working nights and weekends, doing this from the depth of your heart and without being paid for it or without being monitored for how much that you are doing. I just want to say thank you. I mean, this initiative really is about everyone's collective efforts, as you heard so nicely from Hassan. So thank you to those that work alone at night for the hours that you put in. It's made a difference. We've come a long way in 5 years. We have a long way to go, but we look forward to continuing this journey. And also just want to thank the survivor for sharing the story, because this is what keeps us grounded. So let's be motivated by the words we're about to hear. And thank you again to CCCL and King Hussein for the opportunity to join.
Yes, and I just want to add to that I'm extremely grateful and for you listening to me and for me having the opportunity to listen to your knowledge and information. It's really valuable, and I hope that, well, the future is bright and we can see the changes. Thank you.
A message of optimism. Wonderful. Thank you so much. And let me introduce to all of you Lynn El Haj. She's a survivor and one of the 350 members of the Champions Circle Club at CCCL. Today, Lynn is pursuing her study at university and she's looking forward to becoming a clinical psychologist to help patients with cancer. Lynn, welcome, and go ahead, please. You need to unmute you first. Not sure if we can connect. I think Lynn disconnected there for a second, so okay. We have you back, Lynn. Go ahead.
So sorry for the technical difficulties. Thank you for having me. My name is Lynn Haj. I'm 21 years old. And as you've mentioned, I'm currently majoring in psychology and hopes to pursue a career in clinical psychology. My survivor journey started back at the age of 2 years old, where I was first diagnosed with leukemia and then treated in Children's Cancer Center in Lebanon. Yet, unfortunately, I then relapsed at the age of 6 years old, where I was retreated back again in Children's Cancer Center in Lebanon. Obviously, my journey was full of ups and downs. However, I do still carry the great times and the strong willingness till this very day. I believe I was lucky enough to receive great social support, as well as great strength from all the family, friends, and medical staff at the time. I think just like any other young patient at the time, I was very confused with everything around me. Just like being pulled in and out of school, spending several days in the hospital and whatnot. However, my parents' guidance and strength really did naturally motivate me to keep a positive outlook, despite how uneasy it was to process at the time. I was also provided immense social support from CCCL, and I personally believe that such support has kept me up on my feet ever since. And CCCL played an important role in always keeping a patient busy with various productive activities and events just to distract you from any form of pain at the time. And I do strongly think that CCL have and always will advocate for patients' rights, for affordable treatment, especially at these current times, and facilitate the process for access for treatment. And such determination reflected through the Children's Cancer Center family in Lebanon, and the morals that they have always held on to has assisted my family and I at the time as well. And the current and ongoing crises that are taking place in Lebanon throughout the regions has not only been difficult for patients' families to afford finances of treatment and get a hold of medications, basically, but it also has been tough on their overall mental health that we really like to shine light on because of how important and significant it is to talk about it. However, CCCL is still and will remain persistent on fighting for patients' rights, along with raising awareness and kind of shedding light on their vision and mission, which is basically to support securing funds for proper education, along with treatment and psychosocial support. And as a survivor and a member of Children's Champions Circle in Lebanon, we are responsible to support and raise much awareness around cancer patients' rights against injustice, especially in like Lebanon and all around regions, basically, in these current times. And I'd like to thank you for having me once again. Thank you.
Thank you so much, Lynn. I honestly couldn't think of a better way of ending this panel today with your testimony. And I think, well, thank you everybody that stayed with us. I know we are running a little bit late, which is quite normal as well when we have such an important topic. I would like to ask you all to maybe turn on your cameras for a final family picture that we are going to take to mark this day, and wish you all to mark this important day in the calendar in the best possible way to raise awareness about childhood cancer, which is why we are here. Thanking again our hosts, both the Children Cancer Center of Lebanon and King Hussein Cancer Foundation. I will ask you now all to have a big smile. Thank again to the panelists. And well, go ahead, Imad or Rosalia, let us know when to smile for the picture.
Yalla, come
Yeah.
1, 3, 2, 1 actually. 3, 2, 1.
Wonderful. Okay,
Yeah,
so I think
okay.
that should be. Thank you so much for staying that little extra and for joining us today. And I'm sure that the team will follow up with the recording being available for those who want to access it. And well, enjoy the rest of your day. And bye bye from now. Bye.